must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show.
Hello, everybody, and thanks for listening to another episode of the Healthcare Education Transformation Podcast. My name is Brandon Pollen, and I'm joined by my fellow co-host, F. Scott Fiel, and unfortunately, our third co-host, Stephanie Wyrock, was unable to join us today for this interview. However, today we are so pumped to have this interview that we've actually been really looking forward to having for quite some time, as we welcome two very prominent special guests from the Federation of State Boards of Physical Therapy. And with that, we welcome Dr. Nancy Kirsch, who is the current president of the Federation of State Boards of Physical Therapy, or we're going to call it throughout this podcast FSBPT for short. And we also have Dr. Richard Woolf, who is the current FSBPT Assessment Content Manager, to understand the perspective from those within FSBPT. Now, for those who are not aware, the Federation of State Boards of Physical Therapy, or FSBPT, is involved in many tasks, but most commonly known for developing the National Physical Therapy Examination, or NPTE for short. Well, I must admit, thank you both for your service to the profession and for coming on the show to chat with us today, because I know I myself and I know our listeners are excited to hear it from your guys' perspectives. But before we kind of dive in there a little bit, do you think that you each could kind of tell our listeners a little bit about your background into who you are and your journey with how you both got involved with FSBPT? And Nancy, how about we start with you, and then Rich, we can follow up after that if that's cool.
Okay, well, thank you very much, Brandon and Scott. We're very, very pleased to be here. I really started my professional involvement with the Professional Association with APTA, kind of going through the ranks from probably the newsletter chair of New Jersey to the New Jersey president, House of Delegates, and delegate for many, many years. And then I was appointed to the licensing board in New Jersey, and that was really the start of my adventures with FSBPT. And the licensing boards of all the states, and we'll get into this probably a little bit more, are part of the Federation of State Boards. And so I was involved from just our local board in New Jersey to begin with, and then ultimately started serving on committees through Federation, and then on the board of directors, and I served as a director and then vice president, and then I was fortunate enough to be elected president almost 2 years ago, and so I've been serving in that capacity since. So that's kind of my introduction and start with kind of how I went from the professional association to the regulatory end of working with our profession.
Well, my background's far more humble than Nancy's. Nancy's so well accomplished. It's just a pleasure to work with her. I remember back earlier in my career, I had recently completed my transitional DPT and had earned a strength and conditioning specialization, and my career had started to take on more administrative role that would eventually lead me to be the director of rehabilitation at a rural hospital in Casa Grande, Arizona. While I was settling into that role, I was kind of thinking about what was next and how could I stay professionally engaged in the profession. And so I decided I would volunteer to be an item writer for the National Physical Therapy Examination. So I filled out an application. I was excited when I was accepted and went and completed my assignment and had a fantastic experience. I had such a good time that I signed up to be an item writer again and went through that process. And again, apparently they liked my items and asked me to play a different role as a volunteer to help other item writers develop questions and serve as an item writer coordinator. So that gave me the opportunity to travel back to the Washington, D.C. area in Alexandria, Virginia, to come to multiple workshops per year and to be involved with the item development process. And then about 10 years ago this week, I actually joined the organization as an employee and have loved it ever since.
Wow, great background stories, you guys. And Nancy, if you don't mind, how did the FSBPT form initially, and how has the organization transformed since its beginning to where it is now?
So that's a great question, because when a profession becomes of age, as physical therapy has, we're a relatively young profession, PT. We're a little bit older in other countries. Our colleagues in Ireland and Australia and the UK, they're almost 300 or over 300 years old, but we're just approaching our 100th birthday. So when you think about it, how we've evolved as a profession in just a short 100 years is really remarkable, from technician to all doctors of physical therapy in terms of our educational programs. So the evolution of FSBPT is part of that growth and development. So the Professional Association, which is just about 100 years old, was evolving and kind of taking care of all aspects, the profession, the growth of the profession, the regulation of the profession in terms of making sure that people were competent to practice, and then, of course, the accreditation of educational programs. And as an organization like APTA grows and develops, it recognizes that there's an inherent potential conflict of doing all three of those things, when the professional association really needs to be engaged in developing and promoting the profession. And yet the regulatory end is protecting the public. And although protecting the public helps the profession, and as you grow the profession, you protect the public, there's that interaction. You certainly have to kind of separate out the looking at how do you determine who's a competent practitioner and who's not. So licensing boards already existed, but they were all, it's very much a states' rights type of thing, and they all existed independent of one another. And coming together, just like our colleagues in medicine and nursing had done, to form a federation where all of the licensing boards would have the opportunity to have resources. And that's really what the federation is. It's an opportunity to provide resources for the member boards, the licensing boards in the 53 jurisdictions, which is all 50 states, the District of Columbia, Puerto Rico, and the Virgin Islands. So that's really where it came about. It's relatively young. We just celebrated our 25th anniversary. So in the early 80s was really when a group of APTA members got together and said, we really need to start to provide these resources for licensing boards. So that's the beginning. And when you look at licensing boards, initially all they really did was keep a list of the people that were supposed to be qualified to practice. And then over time, it was developing things like licensing exams that, determine whether people were competent to practice. And then over time, it was like, okay, how do you make sure that people still are competent to practice? What kinds of things could we require? How do we relicense people? What are we looking for in qualifications? So that's been a part of the evolution. And now I'm really happy to say that we're moving towards remediation, towards helping people stay as competent practitioners and help them if they kind of do have a misstep in their professional behaviors or their competence behaviors, and moving into how do we keep people engaged in wanting to be really competent practitioners. So it's been quite a great evolution in a really very short period of time.
Something I've learned from doing this podcast is that, learning all the different organizations that really contribute to DPT education, from APTA, of course, FSBPT, ACAPT, CAPT, and there's others too. And that's just been fascinating to kind of dive into that. And you had mentioned that, of course, provides resources from boards, really evolving to include exams for competent entry-level practice, but then now kind of focusing more on remediation in that regard. So I kind of want to back up a little bit and dive into that aspect a little bit more. So as you said, Nancy, one of the missions of FSBPT is being to protect the public by providing service and leadership that promote safe and competent physical therapy practice. I'm just curious, how does everything between the member boards, the delegate assembly, board of directors, committees and task forces, and the FSBPT staff, how does everything work together to really achieve this mission, to kind of give some context on how it works from an organization standpoint?
Okay, well, I fortunately came into a really well-functioning organization, so it's a pleasure to be a part of an organization that works as well as this one does. And I think it's because everybody has a very common mission and really is working as cohesively together as they can. Having said that, you need to understand that regulation is a very interesting animal in a democracy such as ours. Every state, all 53 jurisdictions, have 53 ways to do things. And you can be assured that if you ask them, their way is the correct way to do things, which is kind of the way jurisdictions work. So working with that mindset, being able to develop resources such as a couple of years ago, I'm sure you're well aware, there was just a huge push to move anybody that was not a certain profession from being able to do dry needling. There's all kinds of occasional turf wars along the way. And FSBPT produces, sometimes alone, sometimes with APTA, resources to help member boards to be able to provide resources to legislators, to the Division of Consumer Affairs, if that happens to be where they're located in their state. So there's a lot of different ways in which those resources are utilized in order to really give people as many varied but very strongly evidenced types of resources to be able to have a really cogent argument when you go and speak to legislators. So that's one of the primary things. And it really, the way that the organization works, there's the staff, which is the backbone of the organization and really keeps it running on a day-to-day basis and does a lot of the heavy lifting. We have a very nice committee structure both on the exam side and on the regulatory side, and we have task forces when we need them. For example, the new licensure compact was a vision that we really wanted to get off the ground, put together a task force to investigate it, and then carry that through, and now are supporting the licensure compact commission. So going from concept through actual execution. So committees work that way and then report back to the board. Every committee is run by a committee chair who is not a board member, but there's always a board member in the room to listen, to have their ears open, and to be able to bring back information from the committees to the board. And then, of course, the board and the staff work very closely together to accomplish the mission and the vision.
Very cool. Brandon mentioned earlier a couple of the other organizations, but how would you guys say that FSBPT works together with APTA, CAPD, ACAPT, and any other organizations to contribute to advancing the profession?
So that's a great question, because it's critical that we work really closely together. Again, our missions are a little bit different. The Federation's mission for public protection, APTA for the profession, but as I said before, there's a tremendous amount of overlap. So we work, we hope, always as effectively as we can with all the organizations, and I'll just give you a couple of examples. For example, with APTA, when we decided a licensure compact was really a great way in which to help patients to be able to access PT services and to help physical therapists with mobility issues that many of us have trying to work across state lines. We went to APTA, and APTA was also very engaged and involved in wanting to make this happen. It couldn't happen without the two groups really working closely together. So APTA was really spearheaded all of the legislative efforts that took place across the country and are continuing to take place across the country to get states into the compact. Federation took the let's put it together kind of role to make sure that there was the infrastructure to be able to have the compact once the legislation was passed in each jurisdiction. ACAP, we have the Education Leadership meeting coming up in a couple of weeks, and ACAP members are always at Federation large meetings, and Federation is also there at ACAP and presents during the ACAP meeting to bring people up to date on new things that are happening on the Federation side. So it just keeps communication going really well. When we introduced the new way in which schools would register students so that students would have a much easier, seamless way in which to register for the NPTE, ACAP was really instrumental in helping us get that information out to all of their members, and also allowing FSBPT to be able to get that information out and also get feedback from ACAP members. CAPTE, every 5 years now going to one, we take a look at analysis of practice in order to change up some of the way in which the NPTE is presented, and Rich will talk more about this. But CAPTE is involved in giving input into that. FCCPT, which is another organization that works really closely with FSBPT to do credential evals. CAPTE is always there to make sure that what we're looking for in foreign educated individuals is consistent with CAPTE criteria. So there's a lot of overlap and interaction between the groups.
Oh, absolutely. And one thing that you said that really stuck out to me that I really appreciate is kind of this cross collaboration between all groups, recognizing that everyone's got a distinct role and responsibility with some of these issues, and then really getting involved, frankly, with other sides, listening to the other side, presenting at meetings, listening. I think that's great. And I love that aspect from, a cross collaboration standpoint. And you'd mentioned a couple of the organizations, of course, but now let's kind of go a little bit beyond that and kind of just get from the legal perspective how it works. So, Nancy, what are some of the legal, like international laws, that influence how the standards are handled at FSBPT?
So national laws, the only national laws that would come into effect are things like antitrust and issues like that in terms of, people being restricted from trade. But when it actually comes to regulation, it is state by state by state. So being able to even introduce the concept of a compact that would allow people to have a license in one jurisdiction, a compact privilege in multiple jurisdictions, is a huge jump in a regulatory environment that really is so state focused. So the state laws, obviously, Federation doesn't have any input into state laws. What we provide are resources. We don't have anything to do with how a state actually does their business, so to speak.
Each of the state boards are responsible for determining who is safe and effective and who should be granted the licensure. So the NPTE is just one tool that these state boards use to help make that determination. Because of that, we're mindful of our overall process. We want to seek ways to ensure we have a valid and reliable examination. So while the laws don't necessarily dictate what's on the examination, there are several things that we do to ensure that we are handling this the best way possible. So this begins with a publication called the Standards for Educational and Psychological Testing. And this is a joint publication put together by the American Educational Research Association, the American Psychological Association, and the National Council on Measurement and Education. And they define standards for developing tests like the NPTE. And so we use that as kind of our our baseline of where we need to start from in developing these exams. Then we also bring in an external group of really renowned psychometricians. These are experts who are responsible for developing in measurement and examinations, and they make up our technical advisory panel, and they help look at our overall process and say, this is something you could tighten up, or this is something we might be able to work to make even better than it currently is. And then the NPTE program itself goes through accreditation. We go through the Burroughs Center, which is an independent nonprofit organization within the University of Nebraska at Lincoln that reviews the entire process to ensure that we're doing things that are appropriate and will help to ensure that the examination is valid.
Wow, that's quite a process, just learning kind of all the details behind the scenes and kind of how that all works. I don't know if a lot of our listeners are aware of that, to be frank. And, Rich, I know you kind of mentioned parts of this too, but if we could kind of dive a little bit more specifically into the exam on this next one. So, Rich, do you think you could kind of give an outline to our listeners on how, from a content standpoint, the NPTE is developed from the questions and the structure of the exam, to kind of give some context on that?
Absolutely. Well, it all begins, as we mentioned before, with a practice analysis. So we contract with an external agency. Most recently, it's been HUMRO, which is Human Resources Research Organization. And we work with a group of subject matter experts, so PTs for the PT exam, PTs and PTAs for the PTA exam. And they develop two different types of surveys. The first survey is a work activity survey, and they ask recent graduates what things they are doing in the clinic. There's another survey, and that survey is a knowledge and skills survey. And these are sent to experienced clinicians asking what knowledge or skills are required to safely perform these work activities. From the results of these surveys and review of the subject matter experts, a blueprint or a test content outline is created. So the test content outline ensures that the proportion of questions measuring various knowledge and skill level is commensurate with the importance of these areas to physical therapy practice. So then we have a test blueprint. We finally have an outline of where we need to start from. Later, we bring in an external expert to conduct a standard setting workshop for both the NPTE PT and the PTA examinations. And during this workshop is where the cut score is determined for the examination. So it's the standard setting workshop that develops that passing score. And then each year we host multiple item writing workshops where we develop new items for the NPTE. We also host many examination development committee meetings each year for both the PT and the PTA examination programs to review these new items. The Examination Development Committee, which we'll call EDC, also reviews test forms, and they look at each test form to ensure that each item on the test reflects current practice and is entry level, and ensures that items do not overlap or queue with other items on the exam. For example, we want to make sure that item number 3 doesn't help me answer item number 43 on the examination. And that committee also wants to make sure that item 20 doesn't ask the exact same thing as found in item number 200. So after the committee approves the test forms and we perform many additional internal reviews, we package up the examination and we send it to our test provider. We currently use Prometric test centers, and we go and visit those test centers after sending them the information to ensure that the test forms that were approved by the Examination Development Committee are reflected on screen at the testing centers. So for the NPTE PT, there are 200 scored items and 50 pretest items for a total of 250 items, and candidates have 5 hours to complete the examination. For the PTA exam, there are 150 scored items and 50 pretest items, and candidates have 4 hours to complete the examination. Now, the candidates don't get to know which items are the pretest items, and they're mixed, interspersed throughout all the scored items, because we want those candidates to take those tests with that same level of intensity perhaps anxiety that they would have looking at all of the scored items on the exam. And so we want them to give it their best shot as they're answering those pretest items.
Rich, I kind of want to ask one follow-up to kind of what you had talked about. You had mentioned that consulting and bringing in some subject matter experts. From your guys' perspective, how is someone determined to be a subject matter expert for consideration for this?
It's a great question, and it is a long and sometimes difficult process to actually find the selections for individuals here. But what we want to do is select and identify individuals that are representative of the different areas of physical therapy. We want to make sure that we have recent graduates on the task force. We want to make sure we have experienced clinicians on the task force. We want to make sure we have different practice settings represented on the task force. We also want to make sure we've got individuals with different levels of expertise in maybe orthopedic, maybe neuromuscular, etc. So we want to make sure that we have some educators and clinicians. So it is sometimes difficult. We also look at geographic representation. We want to make sure that we are also representing, a wide display of backgrounds, ethnicity, males and females on those committees as well.
Really, really cool. And, Rich, I know you had kind of mentioned a lot of things with kind of the development and such of content and such. To just dive a little bit more, just to kind of give an intro, kind of like an item writer 101 here, what are some of the key features of a successful test question? Like, what are some of the criteria that it has to make to be able to pass to be on the exam?
Yeah, that's a great question. Well, first, we invite some qualified applicants to come participate in an item writing workshop. And while they're there, they receive training during the weekend workshop on what are some of the criteria required for developing these questions. And so they're not pulling it from the ether. They get some training. It is a skill set. It's like riding a bike. It takes practice and repetition to be able to learn how to do it well and successfully. But these individuals are working closely with other experienced volunteers, again, those item writer coordinators who will review the items created by these item writers and ensure that each item reflects current practice, is entry level, has one correct answer and 3 plausible but definitely incorrect distractors, adheres to FSBPT style, and is sensitive and fair for all candidates regardless of where they receive their education. Now, after the item's approved by the coordinator, it's reviewed internally by staff editors to ensure that our standards are met for the style. And then, as I mentioned before, the exam development committee will, this is 5 or 6 individuals, will review each new item to ensure the content is current, is entry level, and has only one correct answer. Then later they will review the entire test form, as I mentioned earlier. But then ultimately the judgment of these items lies in the results of about 300 or more candidates who are administered the new item as part of a test form. After that test is administered, we have our psychometricians review the performance of the new items to ensure they meet our statistical criteria. And if they don't, they can't be used on the NPTE as a scored item. So only those items that go through all that review of committees and survive pre-testing through 300 plus candidates actually make it to be a scored item on the exam.
Yeah, and Richard, just out of curiosity, does most of the questions and answers, do they have to be cited from like research or a textbook, or how do they have to be supported?
Yeah, so each item on the examination has rationales. It's not something that the candidates would see. Candidates can actually see that as part of our practice exam and assessment tool, so PEAT. If they purchase PEAT, they can actually look at some examples of what the rationales would look like. So each item, each correct answer and each incorrect answer is referenced, and we reference it to current textbooks. So textbooks within the last 5 years is what we're currently using to ensure that it's not something that is too far dated. We're looking for items, obviously, that's entry level and is measuring things that have kind of passed the test of time, if you will. You know, the the signs or symptoms of certain diseases or conditions are not something that's going to change with a brand new publication necessarily. They've been around for a while and well established in the medical literature. And so a lot of that information will make it to the textbooks.
Gotcha. And Nancy, after doing a little bit more research and a little bit deeper dive, it looked as though there was a portion of the exam back in the day that kind of included a clinical portion to the licensure for physical therapy. Maybe that was up until the late 80s or so. Could you maybe provide a little context as to how that went and why it ended, and if maybe it should be brought back?
So I'll just briefly comment on that, and then I'll let Rich take over on that, because he's right at the forefront of that particular question. But really back in the day, back in the 70s and 80s and late 60s, there were several states, not all of them, that had a practical portion of the exam, an oral portion. And it could either be something somebody needed to demonstrate or a question that was asked that you had to answer verbally. The problem with it is that the actual reliability between those particular items was almost non-existent. So, it was up to the individual tester to make a determination of whether or not they felt that the person answered or demonstrated appropriately. And of course, they had some guidelines, but as all of us know, having taken OSCEs or TOSCEs or practical exams, testers are different. And so that just did not meet the level of rigor of what has now evolved to the NPTE. But where we're going, I'll let Rich take over and explain where we'd like to be.
Well, I think, part of the challenge is we need to make sure that this entry-level exam is going to be affordable for the candidates. And the cost of developing that OSCE or that practical portion of the examination could be an extreme financial burden to many of these candidates. We know that our colleagues in Canada have this clinical assessment where it's hands-on and they're looking very closely at how individuals perform. And our colleagues in Australia have a similar test for individuals who are foreign educated or wanting to come practice in Australia. Both of those are extremely pricey and very difficult to administer, as far as Nancy had mentioned, just to make sure that it's valid, to make sure that it's fair, and then to be able to do it across the country with the same reliability is a huge challenge from where we are currently. The way we try to handle, at least within physical therapy, is we're really looking at licensure is kind of like a three-legged stool, right? You've got one leg is the National Physical Therapy Exam, where you have to demonstrate that you possess the knowledge to be able to safely and effectively treat patients. But another is that you need to graduate from a CAPTE-educated program, and as part of that, you've got to actually survive your clinical rotations, right? So we in the U.S. are really relying a lot on the educational programs to ensure that all of the graduates have met that standard there. And that's the route that we're currently at. What the future may hold, who knows, right? But I think currently graduating from a CAPTE-educated program or CAPTE-approved program and to be able to survive your clinical rotations. And one of the limitations of a multiple choice question is you may answer for me what is the most ethical way to perform something, but that doesn't mean that you're actually going to do that. And so having a clinical instructor who's going to observe you in the clinic and watch your performance, we think is still a huge important part of that three-legged stool.
Yeah, and that seems very, very interesting. And, Rich, to kind of dive in to kind of a little bit of the exam, for example. So, seeing that the rubric for the NPTE is based on analysis of practice, like you both had mentioned earlier, are there options to potentially raising the level of expectation for this?
So it is a great question that you're asking, but really the question of what do we think about raising the level of expectation of the candidates here? So we need to remember that the NPTE is a barrier for licensure, right? Candidates cannot receive licensure unless they pass the NPTE and complete the other requirements determined by their individual state board. So the NPTE is designed to determine entry-level practice. It's not a specialty examination to look at advanced practice. That being said, with every standard setting that I've been a part of, the standard has been raised incrementally. And as part of that standard setting workshop, there was a justification for that raise in standard developed by the standard setting task force. So the individuals are saying, here's what's happening in our practice. This is why that cut score needs to be raised a little bit higher at this time.
I'd like to get both of your opinions on what the strengths and limitations are currently of the NPTE.
So I think we've kind of hit on some of them, obviously. You've just heard the rigor that is required to get a question onto the exam. So that's the strength, in that it truly is an exam that's well vetted in terms of people's ability to its ability to really differentiate between somebody that does have the knowledge and skills and somebody that does not. Limitations are we're a hands-on profession, so there's always that question of, should we expect that the exam would test some of those psychomotor skills? Or, truly are we comfortable with the fact that we have a fairly rigorous type of clinical practice requirement that's there as part of the education program to really assess the psychomotor skills? So, some people may consider that a limitation and others would not. So I think that for what we're attempting to do, I think that the exam is really strong and it is reflective of practice.
Yeah, I agree with Nancy's points. I really feel our strengths are, we have figured out how to write a good multiple choice question in the field of physical therapy. Would we like to see more of our pretest items survive pretesting and perform better? Absolutely. So we're continually learning. We're looking at what are some of the characteristics of some of the items that perform extremely well through pretesting. Can we mimic that on all of the questions? It's a continual learning process and a lot of challenges involved with this. But again, the limitation is really it's a multiple choice test, and there's only so much that you can ask through the multiple choice test.
Yeah, and those are some really, really good points, guys. And I think that's good for the listeners to know. And I know that, as a profession for PT, we like to try to rely on data as best as we can to help guide our decision making to ultimately progress patients and students, which is really good. And I know you guys had mentioned, both of you, that the mission of the test, of course, is to protect the public. Something I was just kind of curious, is there any hard data that's been done that kind of looks at that safety aspect?
I don't know that we've done a ton internally, but we do know that there is some work done with some other organizations overseas as well that are looking very carefully at trying to correlate how their interest level exam is performing, and are they correlated with incidents of complaint or other challenges there. I think it is a great opportunity for us to be looking at our research moving forward to try to see if performance on the NPTE, or maybe a better question is individuals who took multiple attempts at passing the NPTE, are they more or less likely to run into disciplinary problems during the course of their career?
Yeah, I think you hit it really well, Rich. One of the things we're looking at are what are the factors that would potentially be a risk factor for somebody to either run into a disciplinary action or to a malpractice situation. How do we make sure that the majority of our practitioners are not just safe, but that they're effective practitioners? And one of the things that Rich alluded to, that we can't really write a good multiple choice question question is on that very elusive, all the soft skills of professionalism and ethics and, making those kinds of difficult choices that, often get people or trip people up. But taking a look, and this is something that Federation is looking into, we've just established a research institute that is going to be looking at some of the things that we really don't know too much about yet. As Rich mentioned, if it takes you 5 times to pass the NPTE, what's the likelihood of you having some practice issues along the way? Or does it really matter whether you pass the NPTE by 1 point or 100 points in terms of your practice, integrity throughout your career? And how much does entry-level practice, or the fact that you're competent at that point, what impact does that have on your later competence, or what we have now termed discompetence along the way, as you become less competent in certain aspects of practice, but more competent in other aspects of practice, just because of the areas that you're specializing in? And how do we make sure people remain as competent as possible?
Yeah, I mean, it certainly seems like there's so many moving parts to this, and it's definitely not an easy solution by any means, because I really like the points that you'd made, especially Rich saying that, of course, multiple choice tests can only achieve so much. And I understand that completely. I think all the listeners here do as well. Something that, I'm kind of curious about, I know you guys had both kind of mentioned parts of this a little bit earlier. And of course, there's a lot of moving parts into this, and I know this is a big question. But what would need to happen to have the NPTE to continue to be updated with current evidence more often? And what are the barriers from each of your perspectives potentially to making something like that happen?
Well, I'm excited to tell you about a recent change that we've started this year. So with the approval of the board, the Federation of State Boards of Physical Therapy has started conducting the analysis of practice each year. So what does that mean? Well, that's going to allow us to more closely monitor the trends in the profession to make sure we're still addressing entry-level practice. So traditionally, we had conducted this analysis of practice once every 5 years. And so let's just take, for example, let's say diathermy. Is diathermy in? Is diathermy out? Well, did I just happen to grab a certain sample of a certain year and then diathermy's in on just that one sample, and it's going to take me 5 more years before I find out that diathermy is really out? So being able to look at the practice analysis results from an annual basis is, we feel, going to be very helpful for us to continue to monitor trends in the profession. What's happening with dry needling? Is it becoming closer and closer to being an entry-level activity? These are things that we're going to look at very, very closely over the coming years, and we're excited about.
Yeah, and I really actually like that, kind of doing it instead of every 5, every 1. I think that's really good as well, because I know some people have even mentioned, like, should there be more exercise prescription, pain, and there's a lot of things involved with that too. I understand that. So I think that was interesting to get the perspective. Scott, do you have any follow-up?
Yeah, no, I think that leads me perfectly into my next question. I mean, we hear it a lot, and it's kind of a cliche phrase, well, oh, the schools are just teaching toward the test. And that doesn't just go for physical therapy. That goes for, many medical licensures, as well as, outside of the field of healthcare. But in your expert opinions, I'm curious what you guys would say needs to change so that schools are free to teach best practice and evidence-based practice, and kind of help change some of the outdated methods and materials.
So I don't know that the test is the reason that schools teach outdated information and materials. I think the test really is reflective of practice, and that's what it's there to do, is to make sure that people are competent to practice in the environment we're currently practicing in. I'm a great example of that. When I graduated, it not only was not taught in school, but it was illegal to do any kind of mobilization. I would certainly hope we've moved on, and I certainly have moved on as a practitioner. So, what we're testing and what we're looking at and how we've changed education has to do with really what's happening out there and what the demands are. As entry-level practitioners, there are many skills that we need now that we didn't need. And that's just the tip of the iceberg of what we're going to need in the future. So when schools are teaching outdated material, it's often because they haven't done what they need to do in a really important assessment of their curriculum to make sure that people aren't just teaching what's comfortable for them or what's in their skill set rather than what needs to be taught in order to practice in this environment. So I don't think that's really a function of the exam. I think it's a function of the individual schools, and of course it's a concern that CAPTE has as well.
I'd say this, just to repeat what we all know, that really CAPTE sets the standards for PT and PT education. They've got a lot of very specific criteria, and really the NPTE is designed to be that barrier for entry-level practice, right? We want to make sure we kind of set that threshold for that entry-level practice, but CAPTE wants to make sure that we develop lifelong learners who'll be great practitioners well beyond just passing the NPTE. And so that's really what we're all hoping for as a profession.
Absolutely. And I know you both had mentioned a couple changes earlier on, again, doing that practice analysis every year and a couple other things earlier. But what are some other changes that are occurring and looking to take place with the NPTE and FSBPT that perhaps you guys hadn't mentioned earlier?
Well, I'll jump in here first and talk a little about some future initiatives that we're looking at for the NPTE. So we kind of asked a question back at our most recent practice analysis is, what's kind of missing from the exam? What are some things that we could possibly do differently? And are there alternative item types that would allow us to maybe look at some of that information a little more carefully? And so we're piloting and starting to create on the backside some test questions that use video content, some test questions that are scenario based, where you've got a set of information on the left side of the screen, much like a patient chart, where you've got to kind of sift through and find the pertinent information and then be able to answer a series of questions on the right side of the screen. And so we're excited about the possibility of both of these test items in the future to hopefully strengthen the exam.
And I'd like to look at it from the FSBPT perspective, kind of on the regulatory end. We're really excited about a lot of things that are changing, and one I already mentioned, and that's the licensure compact, which looking at a compact and having people be a little bit more fluid and flexible, and also looking at the fact that we have technology that is going to change the face of healthcare dramatically, has already done so across the world, and we're just catching up here in the States a little bit. But the compact allows us to engage in telehealth at levels that we hadn't ever considered before. The technology is already there, and now we're trying to put the regulation in place to not be a barrier to being able to use some of that technology. I already mentioned the regulatory research group being able to provide some funding to be able to do some of the regulatory research that really has not had any resource or funding before is really critical to really try to understand how do certain people end up having difficulties or causing harm to a patient, where other people could kind of go through their entire practice life without any difficulties, and how do we try to maximize the fact that people can be as safe and as effective as possible. And then the third area in that is that we recognize that we are not an isolated island in the middle of the rest of the world. And we're part of a larger group called NPTRA, which is an international group of physical therapy or physiotherapy regulators. And that is just incredibly exciting, because we have people who are way ahead of us in the States, such as our colleagues in Australia and the UK, and in a lot of things that they do. And then we have groups that are just starting to even consider regulation and the protection of the public, like our colleagues in Sri Lanka and some of the African countries. And bringing everybody together every 2 years, and then having interactions throughout the year. We have several committees that regularly interact with one another to to look at regulation on a global perspective, because very few people just want to stay in one country or just want to have an impact in one country. And we have to understand how regulation occurs across the world, and also what the safeguards are that regulation provides on a global front. So those are some of the really exciting things that we're engaged and involved with.
Yeah, that sounds really neat. And just kind of a hypothetical question for you guys. Let's say I'm a new grad physical therapist and I want to give back to my profession, and I really find a lot of what's going on at FSBPT to be interesting, and I want to get involved. What's the best path to go about doing that? How would you recommend a physical therapist pursue some sort of involvement in FSBPT?
Give us a call right away, especially with the characteristics that you just described. I think our biggest limitation is that people generally tend to get to the regulatory end after they've exhausted or have been very involved on the professional, in the professional association and on the professional end, and then developing their skill sets. And if we had a somewhat younger group of people involved in the regulatory perspective earlier on, it would be fantastic. We're actually looking at our demographics, and they're a little bit more on the more senior side, and that's a complete and total negative, but it's certainly we're not representative of the profession, and we're not representative, more importantly, of the people that we're here to protect. So we really would do very well to have more people understand that their engagement and involvement in regulation is really critically needed, and we need younger people involved. So if they're interested, we'll give you our contact information. You give us a call and we will get you involved. And I'll guarantee you that it will be the most stimulating professional venture you've ever had, because it's mind-blowing to just kind of meet the different ideas, not just on the national level, but internationally as well.
That's good to know, though. And I think, honestly, getting awareness out there that it's not just specifically just this. There's other avenues that you can get involved in, and it's not just as simple. So I think that's a key point, and I think you did a very good job summarizing that. Well, guys, this has been a really enlightening and interesting discussion, and I wanted to thank you both for your time and insight with everything. But we normally like to ask this last question to all of our guests at the end, because, of course, our podcast name is called the Healthcare Education Transformation Podcast. And so the question is, if you could change one aspect of healthcare education, whether that be DPT or other healthcare provider related, which aspect would you change, and how would you change it?
I'll tell you, as a non-educator, I would love to see that everyone, both clinicians and faculty, would have the opportunity to work for a couple of years and then come volunteer to be an item writer. That would be fantastic. We'd get your experience from a couple of years out in the clinic and be able to gather your idea. And I'd probably make sure that everybody who receives that practice analysis survey actually fills it out. That would be fantastic for us as well.
And I'll come at this from just a little bit of a different perspective, because I'm always a clinician, and we're always all educators. And I think that the importance of understanding the 5 roles of a physical therapist and how they all interact with one another is critical. But what I would be more concerned about, or want to at least consider, is that people don't lose their passion that they came into or thought about physical therapy as a career, and lose that somewhere along the line in the preparation for getting into a PT program or actually going through a PT program. And that throughout, people don't lose the focus on that we're here for patients, and that it's an incredible privilege to be able to treat patients. It's an incredible privilege to be invited into somebody's life to do that, and that we don't lose the perspective that we have a professional obligation to be as educated as possible, but we have even more than that, a professional obligation to be passionate about what we do, and also to take on the responsibility to make sure that we're the people providing physical therapy, and that we're also the people that make sure that physical therapy is not something that's dictated by outside sources such as a workplace or payment limitations or things like that, that we take on the responsibility to make people understand what PT can do for them, and then we go out and do it. So that's an educational challenge, because there's a lot that people have to go through to get through the programs, and then also be able to practice in what's not a very easy practice environment right now.
Yeah, I mean, burnout is definitely something we hear about on this show very often, so we appreciate that point. And Richard and Nancy, I can't thank you guys enough for taking your time out tonight to talk with us, and hopefully this podcast will bring at least some awareness to FSBPT for the new generation of physical therapists and physical therapy students. We'll put all of your links in the show notes and stuff, but where can people find you online or on social media if they do want to follow up and have more questions for you?
Well, they certainly can contact us at FSBPT.
Absolutely. As an organization, we're fairly new to utilizing social media, but we do have a presence on Facebook. So if you look up FSBPT, it's there. And on Twitter, we're at the FSBPT if you want to look for us there. Would encourage those that are interested to sign up for our faculty newsletter. And so you can do that from our website. And as you mentioned before, also go to our website and sign up to be a volunteer. We'd love to have you.
Well, absolutely. And I think after looking through FSBPT's website, it's actually amazing how detailed it is really on there. Like there's a lot on there that's very helpful. Like if you have a question with anything, it's all there.
Yeah. Yeah.
You gotta look for it, but it's there.
Yeah.
But guys, again, I echo Scott's comments, and I thank you both so much for your service and dedication and for your time this evening. So thank you both for coming on. It's always a pleasure.
Thank you.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available on our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HETPodcast, on Instagram, HETPodcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.